There was a question about the story you were talking about on food safety principles with the example of the expiry date on canned foods.
Yep.
Right. And so the question is, public health priorities are based today, in today's day and age, on objective scientific criteria and measures.
Yep.
However, very often concerns of the general public, whether they're scientifically based or not, seem to be leading in these types of discussions. What
Yep.
is your opinion on that?
Well, this is very difficult because in democracies, people expect that their voices are heard. And so I think in this case, expired canned food is an easy one. But when you talk about GMOs, for instance, that are accepted in part of the world, but are not accepted in other parts of the world, and there you say the science is the same. You can end up with recalls of stuff that is not really based on well-established science, but it is based on the fact that a large part of the population simply don't accept this. I am not always too enthusiastic about this, but I do accept that this is part of the way you run a country in a democracy. So when it says here in the story, public health priorities are based on objective scientific criteria, I would say not so fast. That is not always true. On the other hand, things that are, say, clearly not based on objective criteria, like this expired canned foods, they tend to slowly disappear. So it's still there, and GHI, the Global Harmonization Initiative led by Huub Lelieveld, is working towards establishing these objective scientific criteria everywhere, but it's still a little bit of an uphill battle.
We'll move to a question from another member on this call. Here she's asking, what is the most effective way, in your opinion, Peter, to enforce food safety management effectively? Is it cost and effective profit management from doing food safety right? Or do you feel is it also about sharing the fear of food safety incidents or risks that may happen to us?
Well, it's a bit of both, I think. You can make an argument about the costs of everything involved, but at one point I have been involved in a discussion where I was asked can we quantify how much we save by doing the right things? And I said, well, that would be easy because you simply add up the cost of everything that we have prevented. Well, of course, that doesn't work because if you prevented that, then we cannot calculate cost. In a story here, it talks about somebody who said, a senior manager who said, well, we see QA and food safety as insurance. And the person that writes this story says, well, I see it as almost exactly the opposite, because if you have insurance, then the idea is that you pay some money and then you can continue to do what you're doing. And then if it goes wrong, the insurance will pay out. Now, if we do QA and food safety, then the message is that you cannot continue to do what you're doing. You have to change your ways. And if it still goes wrong, then we're not going to pay out. So it is a difficult message. What I have seen and what many people around the industry have seen, that for one thing, there's a general tendency over the years to take this much more seriously, and the whole system of GFSI certification has helped a lot there. On the other hand, if you look more closely into the internal procedures and standards of companies, you can almost see exactly where disaster has hit. And if you go back and say, why are you so strict on this particular thing? Then usually the reason is in that particular area, we had a very nasty incident and we decided that this would never happen to us again. And so I have seen a good example of a company that was hit many years ago by something in the toxicological area, and they put quite a bit of energy and resources into toxicology. And then later, of course, they shifted that to microbiology, but you could see there that by the sheer effort that they put into that, how badly this has hurt them. So yes, there's a general tendency to go there. It's built into what everybody needs to have at this moment is a certificate based on the GFSI standards. That helps a lot. But also, if something has really hit them, that is where they tend to learn. And well, it's unfortunately, but that is often the way it works.
And there's and I think it will make this one of the final questions. So the other questions we'll answer after the webinar because we need to keep an eye on the time. But this question really is a follow-up of what you just called, and it's about the recent global recalls that we have seen in the industry. So the question is really, would you say that corporate memory is also rather short, and that industry sometimes doesn't learn from its own mistakes as much as they should?
Yeah, well, to a certain extent, that is true. But, and there's always pressure. If something goes wrong, then can we wish it away? And of course you can't. I am somewhat more optimistic about that. I think a lot of companies, probably the larger companies, sooner than some smaller ones, but simply because they are larger, they have more exposure, they had more chance to run into difficulties earlier and learn from that. But it continues to be somewhat of an uphill battle. And in the book, you will see things that, well, I mentioned a lot of things having to do with food safety culture. But here in chapter 2, it mentioned uphill battles. And yes, to a certain extent, it continues to be an uphill battle, and short memories are a part of that.
Great. I want to thank you, Peter, for sharing all of these stories with us today and for answering all the questions that the audience had for you today. I'm very much looking forward to the book. I can't wait for it to be published. And then I'd like to close the Q&A session here. We'll answer the remaining questions through email and then hand it back over to Rob for a final closing. Thank you, Peter.